the study that we conducted was a phase 2 study of combination ruxolitinib and decitabine. This was the MPD-RC 109 study, and this was a study in patients who have accelerated phase myeloproliferative neoplasm or blast phase myeloproliferative neoplasm. So a total of 25 patients were enrolled on study, and of those, a subset were evaluable for efficacy response, about 18 patients out of the 25. So in this study, we saw that overall the regimen was well tolerated. We did see CRIs as well as partial responses, as well as about 30 to 40% of patients who did not have a response to therapy. The survival of the patients with accelerated phase was on the order of 7 months or so, and those with blast phase disease had survival median of about 9 months. The adverse events that we saw in this study were typical for this population, including fevers, mostly neutropenic fevers, as well as anemia and thrombocytopenia. Those were the major side effects that were observed. So compared to standard conventional chemotherapy, if we look at historical controls, it certainly seems that the regimen is well tolerated, doesn't really require hospitalization, and perhaps the outcomes might be favorable compared to standard induction chemotherapy regimens. Nonetheless, it's clear that we still have a lot of work to do and that the outcomes are not optimal. These patients are patients who do poorly in general, and therefore further studies are required. However, this regimen might serve as a backbone to the addition of other novel agents.